Hello viewers, today I have the privilege of speaking with Kelley Mondesire, Doctor of Chinese Medicine, and she's based in New York City. Kelley, thank you for joining us.
Thank you, Kanika, for having me today.
What about your work in men's health and how you treat a prostate cancer patient?
Yes. Prostate cancer is just as devastating and life-changing for men as breast cancer is to women. Some of the side effects of prostate cancer are predominantly erectile dysfunction, dribbling urination, lack of libido in general, neuropathies, some of the same symptoms that we see in women with breast cancer, we see in men with prostate cancer. Now, it depends if the prostate has been removed or we're using seeds, radioactive seeds that are inserted into the scrotum of the patient. So what happens there is those radioactive seeds, in the case of this type of treatment, can heat the patient up so much that they actually get cold. So as a patient might present with 104 fever if they have a different type of disease, when a patient has such a high temperature, they tend to shiver because they become cold. This is what happens with the lower portion of the male's body with radioactive seeds. The nerves that innervate the legs and the feet tend to heat up so much they become cold. And quite often this is misdiagnosed as a heat condition where it's really not. It's a cold condition, and such as a person who suffers from frostbite of the toes, which is a very painful condition. This is what we see in the prostate cancer patient. So the idea is to warm up and get the blood circulation flowing through the nerves of the lower lumbar and sacrum to innervate the peripheral nerves that carry on down to the feet and the toes. One of the methods that we add to the acupuncture needles is moxibustion, and moxa, or aya, or mugwort in different translations, is an herb that we heat on the needle, or we might have a stick made of this herb, and it actually warms up the lower sacral and lower lumbar area of the male patient, and this will indeed help to relieve those neuropathies. As far as the dribbling urination and the erectile dysfunction, sometimes there's nothing we can do about the erectile dysfunction because of the nature of perhaps the surgery that was performed and the aftermath of that surgery. But in most cases where there hasn't been a significant type of surgery or treatment, we can help with the erectile dysfunction. And just like women, men will go through different hormonal changes as well, and they will suffer from the nausea, the xerostoma, the dry mouth, the brittle nails, the different types of side effects that women or experience with breast cancer or any other cancer patient, and they're treated the same.